Good day, I'm Pearl Angelisabel from BSN2B, and for today I will be doing the Enema Administration. Now, the purpose of this procedure is first to stimulate stool evacuation, also as relief for severe constipation, and lastly, it is used for cleansing, carminative retention, and return flow. So following the nursing process, I will do first an assessment for my patient. So I will be checking the patient's last bowel movement, the amount, the color, and the consistency of the stool. Also, I will check if there is any abdominal distension and whether the client has a sphincter control and is able to use the toilet, the commode, or the bedpan. So after assessing my client's condition, I will now proceed on planning. So I will be identifying for any kidney or cardiac diseases that may contraindicate the use of enema, and also I will check the doctor's order for the need of enema. So it states here that the doctor ordered administering enema. So after that, I will now proceed on the preparation of the equipments I will be using. So I will need a disposable linen saver pad, also a bath blanket, clean gloves, also a water-soluble lubricant, and then a paper towel, and then also I will be needing the correct amount, solution, and the type and temperature of enema I will be using. After that, I will now proceed on the performance of the procedure. So I will be lubricating about 2 inches of the rectal tube, and also I will be running a small amount of solution through the large volume enema and rectal tubing to expel any air out of the tube. And then after that, I will close the front of the tube. So I will be lubricating it. This is to have a smooth entry of the tube when I insert it in the rectal area. And then after that, I will be now introducing myself to the patient and verify my client's identity, explain the procedure, why is it necessary, and how the client can cooperate. Also, I will be instructing my client that there might be a feeling of fullness once I administer the enema solution. So, good morning, ma'am. I'm Principal, your student nurse for today. Would you mind if I ask your name? Okay, how about your age? Okay, ma'am, that's good. So, for today po, I will be administering an enema in your rectal area. This is to stimulate stool evacuation and to relieve severe constipation. Also clean the rectal area. Will that be okay? Okay, let me just double check, ma'am, that you already signed a written consent of this procedure. Am I right? Okay, ma'am. During the procedure, when I already administered or I started administering the enema solution, there might be a feeling of fullness within that area. So would you care to notify me if you are feeling any discomfort or any untoward reactions during the procedure? Okay, ma'am, thank you. So after that, I will now provide hand hygiene and observe other infection control procedure. So in here, I will be wearing my clean gloves. Now that I already have my gloves worn, I will now provide for my client's privacy. So I will be closing the curtains around the bed and the door to the room. And I will also provide an adequate lighting for me to have a clear visualization when I start the enema administration. So after that, I will now assist my patient to a left lateral position with right leg flexed, and I will make sure that the disposable pad is under the buttocks area. So ma'am, I will start na po the procedure, so let me just turn you on your left. assuming that we will have the right leg of the client flexed. And then I will be placing the disposable linen saver pad under the buttocks area. And then after that, I will now start inserting the enema tube. So we have here our makeshift enema tube. So I will be inserting the tube into the rectum about 3 to 4 inches smoothly and slowly, directing towards the umbilicus. So in inserting a tube, we should always remember that we should never force it. So if resistance is encountered in the internal sphincter, let's ask our patient to take a deep breath and we will run a small amount of solution through the tubing. But if it doesn't work, then withdraw the tubing, check if there is any feces present, and if there is any, withdraw the tube and flush it, and then retry the procedure. So if all of that doesn't work, then do not do the procedure at all, and report the resistance to the primary care provider or the nurse in charge. So I will now be administering the tube. So assuming that this is the solution container, so I will administer the tube na po, ma'am, okay? So 1, 2, 3, 3 to 4 inches. And then after that, I will now administer the enema solution slowly. So assuming that this is the solution container, so I will hang or hold it on the above the rectum or the rectal area, and then I will open the clamp to allow fluid flow, and I can also compress it if we are using a compressible container. So in administering enema for low enemas, usually the solution container is hung or hold about 12 inches above the rectum, and for high enemas, it is 18 inches above the rectum. So we will administer the enema solution slowly, and if the client complains of fullness or pain, we will lower the container and then close the clamp to stop the fluid flow for 30 seconds, and then after that restart it again, open it again, and let the fluid flow for a slower rate. So when using a plastic commercial container in administering the enema, roll the container as the fluid is instilled. So after the fluid is instilled, all of the fluid is instilled, or the client said that he or she cannot hold it anymore and wants to defecate, then lower the container and then close the clamp, and then withdraw the rectal tubing from the anus. So, and we will use a paper towel when withdrawing it. So we will withdraw it, and we will wrap it and dispose. So in enema administration, we will need to encourage the patient to retain the enema as long as possible. So we will instruct the client to stay in a lying position and then retain the enema for 5 to 10 minutes if it is a cleansing enema, and for 30 minutes if it is a retaining enema. So after that, we will now assist the client to defecate. So we will assist the client to use the bedpan or the commode, and then once the client is already done defecating, instruct the client not to flush the the feces afterwards because we will observe it. So we will observe it using a bedpan, commode, or in the toilet. And then if a specimen is required, we will use a bedpan. So let me just assist my client to use the bedpan. So once the patient is already done defecating, we will now remove the bedpan and render a perineal flushing, and then we will observe the feces. Now, for the variation of enema, if we are administering an enema to an incontinent client, then once the tubing is inserted or the rectal tubing is inserted, we will assist the client to a supine position in the bedpan, and we can elevate the head of the bed for a easier breathing. Now, if we are using a return flow enema, so this is for return flow enemas, we are using a 100 to 200 ml solution, and we will instill it through the rectal or rectum area and the sigmoid colon, and then we will lower the container and so that the fluid will flow back through the rectal tubing to the container, and so on and so forth, pulling the flatus with it. So the inflow and outflow process will be done for several times and for about 5 to 6 times, and then the solution will be replaced throughout the procedure for several times depending if it gets thick with the feces. Now for the evaluation, we will document the type and the amount of the enema given, and the type of the solution, the length of the time the solution was retained by the patient, the amount, color, and consistency of the stool, and the relief of flatus and abdominal distension. And then we will also observe for any reactions or possible reactions of the client to the administered enema. And after all of that, I will now be removing my gloves and I will do a proper hand hygiene. So that's all for the enema administration. Thank you.